Okay, let's talk about diagnosis and the thing that drives me insane every single day when I get a new patient coming in for an eval who's been to see their primary care or the orthopedic specialist, or they saw a chiropractor, whoever, and they were told they have diagnosis XYZ. So keep in mind, when people go to see medical experts, they think that the medical expert actually knows what they're doing, which they should. I mean, shouldn't that be the way that it works? You go see somebody who's a doctor, and they should know what they're doing when they examine you and tell you what's going on and all that kind of stuff. They should, okay. So here's the problem. The medical profession as a whole is meant to get people in, get people out as fast as you can. There's no thought process. There's no critical thinking. There's no root cause of anything. It's tell me what hurts, and I'm going to tell you why that hurts right there. Okay. So understand that when somebody has sciatica, and they don't have sciatica 24/7, so they have sciatica after they sat in a plane for 2 hours and their butt hurts, and they get out of the plane and they go to the doctor. They go to the doctor a week after they had this sciatica, and the doctor says, oh, well, your butt hurt while you were sitting down 2 weeks ago, and every once in a while it kind of hurts. You have sciatica. No, they don't have sciatica. They had a snapshot of a certain part in time where they had symptoms that would correlate with sciatica. Now, if the people handing out diagnoses would say, it sounds like at that point you had what could have been this or that, that's what that pain was, that's a lot different than saying, oh, you have sciatica, you have plantar fasciitis, you have epicondylitis, you have bursitis. Okay, that is all crap, okay? Because as we know, as we went through, as you've been watching my content, and hopefully you were on the 3-day challenge, you know that a diagnosis is nothing but a fancy word to describe symptoms, and usually the location of the symptoms. And it's usually a snapshot of when that happens, because the symptoms aren't constant all the time, okay? So here's what happens in the mind of the layperson when they're told they have this affliction. I have this affliction and it's there forever. What makes it worse is when they go see somebody like a physical therapist for their plantar fasciitis, and they say, oh, you have plantar fasciitis, so now we just reinforced you have this affliction, and you're going to have to put these things in your shoes because there's no way you're ever going to live another day the rest of your life without this affliction of plantar fasciitis. So you're going to have to wear these orthotics for the rest of your life. That's how we treat it, because you have this affliction, this disease, this diagnosis, which is absolute horseshit. Okay. So I don't ever tell patients they have anything. If they, and this happens, we'll get to the end of the treatment and they'll say, and I'll say, well, you don't have that. And I just leave it there. And I go through the visit, do everything. And they say, well, and now they want to know what they have. So they'll say, well, you said I don't have sciatica, so what do I have? So here's what I say. Well, you had symptoms in your butt or in your hamstring or going down your leg because the muscles that I just worked on weren't firing correctly. So once we get those to fire correctly, and then your joint mechanics normalize, and we take pressure off of tissue that shouldn't have pressure on it, then your symptoms go away. So you don't have anything. If anything, you have muscles that weren't firing correctly. We solved that. So the problem that you walked in with now is solved. The reason why I gave you your home exercise program is so you can stay on top of that, so we hopefully keep the problem solved. Now, you might have some symptoms come back, or some different symptoms come back, because what we did was to get things to work again, depending on how long it's been that you've had this problem will determine how long the symptoms stay away and how much you do your exercises. So you don't have anything wrong with you. What happened happens to everybody every single day, and we just reversed that and gave you some things to do so you can stay on top of it. And then some people will be like, oh, wow, that's really reassuring that I don't have some kind of disease or affliction. Thank you very much. Other people are so stuck in the mindset that you have to tell me what's wrong with me. Well, what was it? And then I'll just say, well, what do you want to call it? So if they had knee pain, I'll say, okay, so you can take your choice. We can call it patellofemoral syndrome. We can call it chondromalacia. We can call it anterior knee pain. We can call it knee pain. We can call it knee instability. We can call it tendonitis. What would you like to call it? And they're like, well, which one was it? And I said, well, all of that stuff is a way to describe the symptoms that you had from the problem that we solved. So you don't have anything. So you can call it whatever you want to call it. Doesn't matter to me, because it doesn't, I'm not treating what your problem is. So hopefully you understand that. So if you are somebody that is in the habit of telling people that they have XYZ diagnosis, once you figure out how to get to the root cause and you can show them how you're reversing the problem that they had, and that's why the symptoms that they have this diagnosis to describe goes away, then you don't have to do that anymore. And when people come in and they have this piece of paper that says, I have diagnosis, whatever, I kind of look at it and say, okay, well, let's go figure out what's going on. Okay, so as soon as they understand that you're going to figure out what is causing the problem, that is causing the symptom that they were given a label to or for, the clouds start to go away, and now you have somebody who actually believes they can get better. When you tell them they have a diagnosis and they have to treat X diagnosis with tape and cupping and stretching and needling and orthotics, they have to do all of these things all the time because they have this thing. Now they believe they have this thing that they can't get rid of, and it becomes part of who they are. I would say there's nothing worse that you can do to a patient than put into their head that they have some kind of affliction that can't be taken care of. So for the rest of their life, they've got to do symptom modification X, Y, and Z to live with this problem that they have, which is absolutely false. So hopefully that made sense. Hopefully that sheds some light on what people are thinking. So when people come in and talk to you about what their problem is, put yourself in their shoes and see it from their point of view, and that will help you better educate them. Because if you see it from a medical professional point of view and you give them a medical professional diagnosis, they don't understand that. They do understand, see how this didn't work, see how it works now, that's what we're gonna do. Makes it really easy. All right, let me know if you have questions or comments.